having me. I'm Michel Valstar. I am the founding CEO of Blue Sky AI. We started the company in April 19, so almost 4 years ago now. I'm also still, I'm a recovering academic, so I used to be a professor. I'm still attached to the university as an honorary professor, but I'm liking the life as the entrepreneur, to be honest. Okay, so today I want to share with you what we do at Blue Sky AI and what software development kits we have available for people who want to create solutions for mental health. So I don't think I need to spell this out. I'm preaching to the converted, but we all know that there's a huge, huge problem. There are so many people who go to bed every day really without any hope, any practical hope that tomorrow will be any better than it is today. Okay, there's many what we call behavior medical conditions. So these are medical conditions that cause your expressive behavior to change, that are just diagnosed far too late, and that's a real missed opportunity. What's more, we also we see that there is a missing language. It's hard to communicate about these problems with your peers, with your doctor, with people who also have the same condition. And we want to give people the tools to make it easier to talk about this. And this will also then help when we give these tools to basically measure and communicate about these issues, to actually allow doctors to talk about that better with their patients. So at Blue Sky AI, we work hard every day to make tomorrow better than it is today. So we're improving people's quality of life. And in particular, we do that by creating the most used technology for ethical understanding of face and voice behavior. That's what we do at heart. We analyze face and voice behavior. And we want to make that available to as many people as possible. I just wanted to give a little bit of a background of where we sort of sit. Some people may have heard of this term emotion AI that's coming around, which is a bit, people are fighting over what it means exactly. So I've been working in the field for over 18 years, and I've worked for Rospicar, who started the whole area of effective computing, which is basically defined as computing that relates to, arises from, or deliberately influences affective elements. But of course, at some point, people realize that we don't just express, we don't just behave for emotional reasons. Quite a lot of it is non-emotional, but still meaningful. And therefore, there's the whole area of social signal processing came around, which is sort of expressive behavior that is social rather than emotional. We then started working on the fact that actually there's like a whole third area of reasons why people behave in a certain way. And that's certain medical conditions that change the way you behave. Like me coughing, for example, right? Which is in a sense an expressive behavior of my face and my voice. So we came up with the term of behaviomedics, which are all those medical conditions that change the way you behave. And given that we have the state-of-the-art technology to very accurately measure the way you behave, if you combine that, you can now start saying something about why people are behaving in terms of the medical conditions that underlie that. That could be diagnosis, diagnostic aids, it could be monitoring, it could be self-help. There's many applications for that. So basically what we do, behaviomedics does, is measuring medically, clinically relevant behaviors. Okay, we do that by measuring what we call behavior primitives first. These are the things that you can just see that anybody does. Blinking, chewing, smiling. These are things that you can just see, and we use special coding techniques such as facial muscle actions to actually create a small list of these behaviors that we then use to say something about the underlying medical conditions such as depression, ADHD, autism, or pain. So we work in the following way. We have core technology that measures the apologies, that measures the face and the voice in terms of these behavior primitives. And all of that is done in a clinical grade way. Ultimately, some of our technology will become medical devices, and we're going through clinical trials as we speak. So that means that all the software we create is created in that same vein. So it's all clinical grade software, even if they're not all medical devices. We make that then available to our customers through software development kits. And in particular, we have 3 SDKs that I want to say a bit more about. One is really to support social robots and virtual assistants. One is specifically to help identify medically related events. So that's the Be Healthy software development kit. And we also work in the automotive industry, again, working on health-related events, but because the automotive industry, of course, is a very specific environment, we have a separate SDK for that. So what makes us different? Well, first of all, there aren't really all that many companies that can infer mental states from face and voice behavior, because ultimately what we're trying to determine is a mental or even physical state that relates to a medical condition. So we do that through the measurement of head actions, facial muscle actions, social gaze, and the voice. But very importantly, we do that very differently than let's say, a Microsoft or Google, because what we do is everything runs on the cloud. Sorry, all the yes, somebody's gasping there. Everything runs on the edge, right? So we do not use the cloud at all. Cloud use, it might be nice, but the problem is that once you start using the cloud, it means that you need to upload a video with what can be very personal face and voice data, video and audio of yourself, up to a cloud, which then gets analyzed. And now you need to trust that somebody, whoever you're sending that to, is not doing something else with your very private data, okay? So we have designed all our algorithms to run on mobile phones, on social robots, very lightweight, very, very fast. So all the analysis happens on your own device, and you don't have to share any of that information if you don't want to. So no video ever has to leave. There was a question earlier about how do you get data, and this kind of data is very private. We take an approach of data volunteering. So we don't even ask people to opt in, because opt-in means you opt in once and then forever you're streaming your data, right? So instead we use a data volunteering principle, which means that when people use an app that we're involved with, or they use our data collection schemes that we run in our offices, people volunteer to donate their data. And then that's a conscious decision that they do each and every time. And of course we make sure that, that they do that well informed. Actually, we've created a tiny little neat little trick where people engage with our virtual assistant, and we've actually written a letter from the virtual assistant to the user, which the user is asked to read out loud. So they have to read that letter from Kira, and that letter actually explains what our data process is in very normal human language. And of course, what we also do at that time is we've got their voice, so we can now baseline against their voice, and we can follow that they've actually read it and not just clicked, yes, I accept. So we now know that everybody has actually read and understood our data privacy policy. Good. So, what do we do? We're a business-to-business company, so we basically provide technology for other people to help the patients or end users. Okay, we don't build apps really that will be used directly by end users. We're not servicing that. So to do that, we have our 3 software development kits. One for the social robots, one for healthcare conditions, and one for the automotive industry. We run clinical trials to create evidence for everything we do, and we provide thought leadership for the space, because this is an emerging space that is growing really, really fast, and it needs adult conversation basically to make sure that people make the right decisions here, and also that the right regulation is put in place, because it will need to be regulated one way or another. So a little bit more then about our software development kit. Be Social was the first one we created. So Be Social was really created for the people who want to build interactive experiences, in particular with social robots. We're already in a social robot in the US, which is designed to be used by children. And with our software development kit in there, you can basically see when they're smiling, how much they're smiling. You can see whether they are confused, whether they are engaged with the topic, whether they're attending to the robot or whether they're attending to someone else. All these things are possible with that SDK, and it runs locally on the little robot. Also, you can use it with virtual assistants. So it's a really useful little tool that you can integrate into your system, and then it gives you a lot more ability to really engage with your user. Basically, we're making it possible for the agents to see their users, right? And respond to their behavior. Then, what is the most important one for this audience really is be healthy. So this is a bit of a mix of your traditional software development kit and your Unity library of assets. I don't know if anybody's ever used Unity and got a virtual scene there or a virtual character there. So what we're creating are interactive scenarios that quite often involve a virtual assistant, or it involves a little psychometric game. It's something that's interactive and that's designed to elicit a particular expression or a particular experience. For example, you can use it to, if somebody has shoulder pain, you could design it to guide someone through some shoulder actions, and then you measure from the face the pain levels from that, which is one of the technologies that we have. So there's a selection of these kinds of interactions, and they can be just your check-in at the front desk of your virtual therapy office. It can be providing people with their results, or it could be actually taking them through an analysis experience. So you basically get the SDK, you select which of the interactive scenarios you want, you white label this for your particular use case, and then with our help, you build your own companion app. So if you are thinking of a more engaging companion app that can measure things about engagement or certain medical conditions in an objective way that you can actually use for your research or for your studies or just to drive your business, come and talk to us, because this is what we now have available. Apologies. One thing that we did, I said we don't actually create our own end-user devices, but of course sometimes we need to evidence that what we do actually works, and also we have this little problem of data collection. So we do build technology that engages with end users and patients. And in particular, we've got two apps. One is called Avocado, one is TrueBlue. Both are designed for to help measure and then prevent perinatal mental health issues. So it's completely designed as a pregnancy tracker used by pregnant women from 3 months pregnant to 6 months postpartum. And it has all the normal elements that you would expect of a pregnancy tracker, information about the stage of the baby, what kind of health conditions you could expect yourself, what change you could expect to yourself or the baby. But then in that, some of those tasks that I mentioned that are Be Healthy are also in that app. So you can now have interactions. You can sing to your bump. You can practice singing lullabies to your bump. You can record a pregnancy diary, which you can then later donate to your children in a time capsule fashion. And during these interactions, we analyze your face and voice, and that's, of course, we tell people that clearly, right? And you get back a indicator scores for depression or anxiety when it's in the clinical version, or poor mood if it's the health and well-being version, because this makes it a medical device, right? If you're going to say something that you've got an indicator of depression, you're now firmly in medical device territory. So in the Avocado app, we don't say that people are depressed or have an indicator of depression. We basically say, well, there's some long-term low mood. You might want to read up on this. And there's some little things in there already, like you can do some yoga. We've got short 5-minute yoga videos in there. We've got some mindfulness actions and that kind of stuff. Nothing very serious, but just to make it a bit of a complete app. This is now going through clinical trials. Approximately 250 women will be using this with the NHS. We'll be looking at how well we recognize the depression indicators and compare that to how well the study team does so. And of course, we're looking at engagement. How easy do people find this to use this and continue to use it, and is it safe to do so? Finally, this might be, well, actually, there are some really interesting use cases of BE Automotive for the healthcare space. The automotive environment is actually really interesting, because if you commute to work, you're basically in the same environment around the same time every day, right? Which makes it like a really nice place to do longitudinal monitoring and starting to observe very small changes in your behavior over time that could be precursors or warnings of anything from just a cold to actually Parkinson's or other conditions like that, the neurodegenerative conditions. So we have an SDK that can work with infrared cameras and with the weird and wonderful angles that cameras in a automotive cabin always end up in. And out of that comes all this information. Now, before you think like, "Ooh, that's scary," and who gets the data? All this is still regulated by GDPR, right? So none of that data will ever leave the car without your explicit consent. Okay, this is something that people might not be aware of. That you own that data, or you don't own it. You have the right to control that data in the car. Secondly, this is a big thing, because from 2024, all new cars in Europe must have cameras facing the driver for safety reasons. So a lot of the car companies are actually interested in doing more than just that. They also want to provide a value add to their drivers and passengers. Okay, that's what I wanted to share with you today. There is a video if this works. I don't know if probably not then. If you click it, it takes you to YouTube, but I don't know whether you have internet connection. Just click the picture in the PDF. No. No? Okay, well, let's leave it at that. Thank you very much. And if you have any questions, I'm very happy to answer them.
Thank you very much, Michel. Thank you so much. We've got time for one or two questions. Yes. Okay.
Thank you for the microphone. Is this language and culture neutral?
No, absolutely not. So we are going to deploy this territory by territory. So we're, and that actually, given that we have to regulate it territory by territory, that's actually not so much of an issue. But yeah, it's definitely language specific. To what extent it's culture specific is less clear. We know that within the UK we don't see many differences, for example, and within the US we haven't seen many differences either. But there's probably more to do there. Yeah.
But you would see a difference between a British person and an Italian person in the facial expression.
You do, but it's not all in the response. We personalize to every individual as well, and secondly, some of the changes in particular for depression, are actually not just in the cultural response, but also in the motor changes that are caused by depression.
Right. Thank you.
Yeah, but it's an important thing, and culture is one of the elements that we segregate or separate our data for, and we do our tests for to make sure that we actually hit the same performance levels for every culture. Yeah.
Hi, it's Nigel Harris. Thanks, really interesting. I've known people with depression very well, and they've masked it, they've hidden it, and a regular person wouldn't know. So is it likely that when somebody knows that this is monitoring, that they will be able to deceive it?
Yeah, that's a very interesting question. So first of all, what we try to approach is the same level that we can reach with PHQ-9, but now at home and without people being able to basically mistype, let's say, on the questionnaires. We have done tests with people trying to either exaggerate or lower their level of depression in particular, and we found that they were not able to deceive the system. Okay. Now, that was done on 100 people, so it wasn't a very extensive test, but that gave us confidence that at least it's hard to cheat the system, which is not necessarily exactly the same thing as also measuring people who, let's say, don't express that or mask it very well, if you understand what I mean. So I can't fully answer that question yet, but it's one that's on our radar and one that we look at. But ultimately, we want to do early detection for as many people as possible. Yeah. And it's also, by the way, a diagnostic aid. So we're always using this in a human in the loop system. Yeah.